Hello, my name is Will Cox, Clinical Educator for the Thuasne Academy. I want to talk about a topic that's really important and dear to my heart. It's related to patients that use the SpryStep device but experience brace pistoning. Now, what is brace pistoning? What I'm referring to is when you have a patient walk with a SpryStep and their heel rises faster than it's intended to, and they feel like their heel is slipping up and down inside the shoe. Now, if you've ever come across that problem, there's a couple ways to address it. And I want to point out that one of the factors that may contribute to the heel rising up and down is just due to the fact that the profile of the foot plate is relatively wide compared to the shoe. Now, what happens is that the device tends to splay out the shoe and widen the heel counter. And this can put pressure on the heel, but more importantly, that heel counter loses its cupping effect and the heel will slide up and down. To address that, you can narrow the profile of the foot plate up to 1/4 inch on the medial border. This will narrow the profile of the device and encourage the heel cup to maintain its profile so that it seats within the shoe properly. There are some other things that you could do to help, which include making sure you take and access the top eyelet with the laces. If you go to the very top eyelet and string the laces through there, it'll create a vector force which will drive the foot more towards the back of the shoe, and that will help create a force pattern that will contain the foot and make sure that it stays inside the device. Now, the third factor, and this is pretty important, is that the device is too stiff relative to the patient's manual muscle test condition of the plantar flexors. Now, you might be asking yourself, what are you saying? Well, I'm basically saying that the patient might be overpowering the device. Now, if you have a condition like foot drop, but the patient has strong plantar flexors still, and those muscles are intact, what that means is that the patient has the capability to actually push their foot out of the device. So two things are happening. One, the foot isn't moving with the foot plate, meaning that the foot plate is too stiff, and then the patient then pushes up and out. The other thing is that those gastroc and soleus muscles are actively firing, and that is a great thing because we want to see that muscle recruitment stay engaged within the device. So the solution in that scenario would mean that the patient should actually move to a more flexible device, and we do have a solution for that. If you start with the SpryStep Original, you would then defer to the SpryStep Flex, and that would be an appropriate option to counterbalance the muscle strength, so you have a device that moves with the foot and ankle and allows for the muscle contraction of the gastroc soleus to remain intact for therapeutic reasons. And this is very important to match the device relative to your patient's muscle strength. And this is a great way to resolve a relatively simple problem, which is heel pistoning. It's a good, bad problem to see. It's good that they have the strength, but it's bad that it's happening. But now that you know the solution, you can just move them to a more flexible device and they'll do quite well. For more information on the SpryStep line, visit thuasneusa.com. And if you have questions about this device in particular or the other range, talk to a Thuasne USA representative.